Surprise! I'm dropping a special episode today because a topic I am deeply passionate about is making headlines and gaining traction. And I've got some thoughts. If you're new here, welcome to Exam Room Nutrition, the podcast that helps you give better nutrition advice. I'm your host, Colleen Sloan. I'm a PA, dietitian, and this is the Nutrition Newsroom, a special monthly segment where I break down the latest nutrition headlines. Let's talk about RFK Jr.'s proposal to mandate nutrition education in every U.S. medical school. He also warned that if schools don't comply, they could lose federal funding. Now, on the surface, it sounds like an obvious solution to America's health problems, right? Doctors should know more about nutrition. Absolutely. But as someone who lives at the intersection of medicine and nutrition, let me tell you, this idea, while well-intentioned, misses the mark. And I'll be following this proposal for details on how he decides to implement it very closely. Now, I have a unique perspective here. I'm a physician assistant and a registered dietitian. I've worked in both exam rooms and kitchens, and I've built an entire platform around teaching medical professionals how to deliver better, evidence-based nutrition advice. Maybe you've heard of Exam Room Nutrition, the podcast you're listening to. So yes, I've seen the gaps and the frustration firsthand. But before we crown this proposal the fix-all for what ails American healthcare, let's dig into what's really going on. Okay, first of all, medical students do learn about nutrition. It just might not be enough. RFK claims that doctors get zero nutrition education. Now, this is catchy and clickbaity, but it's not entirely accurate. How much nutrition education a medical student receives really depends on the program. I've seen in some schools that it's just sprinkled throughout the curriculum. Others I've even seen offer a dedicated culinary medicine course, which is super cool. And while the National Academy of Sciences recommends at least 25 hours of nutrition education over 4 years, there are currently no nationally required nutrition competencies in U.S. medical education. However, there was a consensus statement in JAMA in 2024 by David Eisenberg and Alexis Cole titled Proposed Nutrition Competencies for Medical Students and Physician Trainees. I'll link to this article below because it's got some really interesting insights in the courses that should be taught to medical students. But currently, the nutrition that is taught is inconsistent at best and optional at worst. Now, let me be clear. I am not arguing that doctors don't need more nutrition education. They do. Most could absolutely benefit from it. And many surveys show that graduating physicians don't feel confident talking about nutrition with their patients. But the idea that adding a course or two in med school is going to radically transform American health, that's a vast overstatement. Because here's the real issue. More education doesn't automatically mean a doctor feels equipped to have meaningful nutrition conversations with their patients. Our patients don't need more information. In fact, they're drowning in it. They need help turning that information into action. The nutrition doctors learn in med school often stops short of what actually helps in practice. They can memorize the guidelines, the disease states, the mechanisms, but translating all of that into real-world conversations with busy, overwhelmed patients, that's where things fall apart. When a parent says, "My kid only eats crackers," or a patient says, "Hey, I work night shifts, so what should I eat?" That kind of guidance doesn't come from a lecture. It comes from experience, or better yet, from working alongside someone who's trained for it. And news flash, there's already a profession dedicated to nutrition. Hi, it's us, registered dietitians. We are literally trained in nutrition. That's our thing. We hold a master's degree in nutrition science. We study biochemistry, food science, medical nutrition therapy, just to name a few. We complete 1,200 or more hours of supervised practice, then we pass a board exam, and we maintain continuing education. Plus, we have something that doctors rarely get. TIME, time. Time to sit with patients, explore the nuance, and personalize their plan. Because sure, we might have learned to increase the patient's fiber if they complain of constipation. But if that doesn't work for this particular patient, dietitians can troubleshoot. We can get creative. We can figure it out. Because dietitians don't just hand out advice. We help patients apply that information. We work through the roadblocks. We provide frequent follow-ups and support behavior change. Because telling someone what to do is only half the job. Helping them understand how to do it and stick with it is where real change happens. So yes, I appreciate that RFK wants to make nutrition more central to healthcare. But the idea that we can fix this with 1 or 2 med school lectures, that's optimistic at best. In my opinion, the real problem isn't education for doctors. It's the system. Doctors are not failing their patients because they don't care about nutrition. They're failing because they're overbooked, overwhelmed, and buried in a system that prioritizes billing over behavior change. Think about this. In 15 minutes or less, usually, a doctor has to review labs, refill medication, address the patient's current concerns, click through an obnoxious EHR, fight with insurance, go through prior authorizations, and maybe have time to mention food. Now, even if that doctor is an expert in nutrition, they simply don't have the time to give it the attention it deserves. Our patients deserve more than, hey, try to cut back on eating out, or you should swap soda for water. Now, it's not that doctors don't want to talk about nutrition. It's that they're stuck in a system that makes it nearly impossible. And I'll be honest, I'm a pediatric PA and a dietitian. I am an expert in nutrition. But when I'm in clinic wearing my PA hat, seeing 30 kids a day with 10-minute slots, no, I don't have time to counsel the exhausted mom of a selective eater who cries at the sight of anything other than chicken nuggets and mac and cheese. Do I know what to say to help that family? Absolutely. But do I have the time and space to support them in the way they need in that moment? I don't. That's why more education isn't the fix. It's not about what we know. It's about what the system allows us to do. And placing the full responsibility for nutrition counseling on doctors is not only unrealistic, it's unfair. Doctors can't be everything to every patient. That's not what they were trained to do. And it's not what the system is designed to support. So, if RFK really wants to fix healthcare through food, he shouldn't be rewriting the syllabus. He should be rewriting the system. Now, a smarter place to start, I think, is residency. If we want nutrition education to actually stick, we need to teach it when it matters most, during residency. That's when doctors start to specialize. That's when a family medicine resident sees diabetes every day, when a GI doc sees firsthand how food affects every gut differently, when a pediatrician guides families through a baby's first year of feeding. That's when nutrition education becomes real, relevant, and useful. Let's tailor their training to their field, make it practical, integrate it into real patient cases, and let's have dietitians teach the coursework. Most medical schools are connected to hospital systems and universities. Use the dietitians already working there. Have the residents shadow the dietitian, learn from them. And while we're at it, let's stop pretending doctors have to do this alone. Yes, teach them the importance of nutrition. Give them the tools to answer quick questions and plant the seed for healthy change, but also teach them when it's time to pass the baton to the dietitian. Because some nutrition answers require nuance and time and coaching, and that's exactly what dietitians are trained to do. So while this all sounds amazing and I'm really getting fired up, it brings me to the next barrier. Even when doctors want to refer patients to a dietitian, they often can't. Why? Because insurance won't cover it. Why are we waiting until a patient has diabetes or end-stage renal disease to make nutrition counseling accessible? If we're serious about food as medicine, let's start acting like it. Let's make it easier to see a dietitian. Let's fix broken reimbursement models. Let's make dietitians accessible and affordable for every patient, not just those who already qualify under narrow billing codes. And let's pay them more than $25 an hour. Isn't our society's health worth more than that? And let's stop treating dietitians like a bonus add-on and start treating them like the essential care providers they are. I firmly believe that healthcare is a team sport. It's time we use the whole team. We don't expect cardiologists to do dental work. We don't ask dermatologists to perform chemotherapy. And we don't expect primary care providers to provide speech therapy or physical therapy. So why are we expecting them to own the entire nutrition conversation? Healthcare is a team sport. And when it comes to nutrition, registered dietitians are the MVPs you want on the field. So yes, let's teach doctors how to recognize when nutrition matters. Let's teach them how to talk about food with compassion and curiosity and evidence, which is exactly my goal with my platform, Exam Room Nutrition, this podcast, my social media pages, my newsletter, and my obesity medicine nutrition course. That is my goal, to equip clinicians with better, more accurate ways to talk about nutrition. But let's also give them a team, and let's make sure dietitians are actually on it because they deserve a seat at the table. So I am all in for better nutrition education in medicine, and not just for doctors, but for PAs and nurse practitioners as well. But if we're going to do it, let's do it right. That means empowering dietitians, reforming change, fixing systems, training for teamwork. Because one more lecture won't fix what's broken, but having the right team, it just might. As you can tell, I am so fired up that nutrition is making national headlines. I've written an opinion piece about this on my blog. I've also written a few pieces on social media, so if you follow me on LinkedIn, feel free to comment on that post or even on my Instagram account. Both of them, you can find me at Exam Room Nutrition. I would love to hear your thoughts on this topic, so send me a DM, again, at Exam Room Nutrition, or if you want to keep it private, shoot me an email, Colleen at examroomnutrition.com. So thanks so much for listening to this special Nutrition Newsroom episode. And as always, let's continue to make our patients healthier, one exam room at a time. I'll see you next time.